Valvular disorders basic principle. The heart has four valves: tricuspid, pulmonary, mitral, and aortic, that prevent backflow. Valvular lesions generally result in stenosis, decreased caliber of the valve orifice, or regurgitation backflow. Acute rheumatic fever. Systemic complication of pharyngitis due to group A, beta hemolytic streptococci affect children 2 to 3 weeks after an episode of streptococcal pharyngitis, strep throat, caused by molecular mimicry. Bacteria and protein resembles protein in human tissue. Diagnosis is based on Jones criteria. Evidence of prior group A beta hemolytic streptococcal infection, for example, elevated ASO or anti-DNase B titers with the presence of major and minor criteria. Minor criteria are non-specific and includes fever and elevated ESR. Major criteria: migratory polyarthritis, swelling and pain in a large joint, for example wrist, knee, ankle, that resolves within days and migrates to involve another large joint. Pancarditis. Endocarditis, mitral valve is involved more commonly than the aortic valve, characterized by small vegetations along lines of Collier that lead to regurgitation. Myocarditis, to Escoffe bodies that are characterized small vegetations along lines of Collier that lead to regurgitation. Myocarditis with Escoffe bodies that are characterized by foci of chronic inflammation, reactive histiocytes with cylinder wavy nuclei, joint cells, and fibrinoid material. Myocarditis is the most common cause of death during the acute phase. Pericarditis leads to friction, rub, and chest pain. Subcutaneous nodules, erythema marginatum, annular non-pruritic rash with erythematous borders, commonly involving trunk and limbs. Sydenham chorea, rapid involuntary muscle movement. Acute attack usually resolves but may progress to chronic rheumatic heart disease. Repeat exposure to group A beta hemolytic streptococci results in relapse of the acute phase and increased risk for chronic disease. Chronic rheumatic heart disease. Valve scarring that arises as a consequence of rheumatic fever results in stenosis with a classic fish mouth appearance. Almost always involves the mitral valve, leads to thickening of chordae tendineae and cusps. Occasionally involves the aortic valve, leads to fusion of the commissure. Other valves are less commonly involved. Complications include infectious endocarditis. Aortic stenosis, narrowing of the aortic valve orifice, usually due to fibrosis and calcification from wear and tear. Presents in late adulthood, more than 60 years. Bicuspid aortic valve, increased risk and hastens disease onset. A normal aortic valve has three cusps. Fewer cusps results in increased wear and tear on each cusp. May also arise as a consequence of chronic rheumatic valve disease, coexisting mitral stenosis, and fusion of the aortic valve commissure distinguish rheumatic disease from wear and tear. Cardiac compensation leads to prolonged asymptomatic stage during which a systolic ejection click followed by crescendo-decrescendo murmur is heard. Complications include concentric left ventricular hypertrophy, angina, syncope with exercise, microangiopathic hemolytic anemia. Treatment is valve replacement after onset of complications.